is a natural part of life. Everybody faces it at some point of their lives. So, doctor, what are the different pain related cases you face in your practice?
Yeah. As you told, pain is a condition which affects mental and physical uh, activities of a person. Even if a pain is milder, it can affect his or her daily activities, and it may lead to some discomfort for that individual. And in my clinical practice, usually severe cases of arthritic pain, rheumatological, osteoarthritic pain are coming. Also, migraine, several types of headaches are also coming.
What about you, doctor?
Actually, considering our Indian systems of medicine, this pain is not particularly mentioned in a particular point. There are a group of pain that is particularly mentioned only as Sulai in Siddha, and in Ayurveda Shula. And it is there in some other parts of the disease also. In many Vata diseases also pain will be manifested. And in many other conditions also, as doctor already mentioned, like hormonal related issues in women, and also headache and many other pains are there. But considering present scenario, the pain is particularly important mostly in case of arthritic related pain, back pain, and generally joint pain, anasarka and everything that will be happening because of primarily due to two causes. One is disuse and the other is overuse. Disuse is particularly coming when talking about sedentary lifestyle. Due to this, nowadays most of the people are working in sitting job. Overuse is coming in another scenario, like hardest job, continuously doing for a very laborious jobs. Such things, these two are the primary cause for pain, considering this arthritic pain or joint related pain. So the management of this is also, we should consider these two aspects. What is the cause of pain, like that.
So, what about the management in Ayurveda for these pains?
Yeah. In Ayurveda, pain, as doctor told, is considered as Shula. Main dosha responsible is Vata. Vata dosha is responsible for the pain. Without Vata, there will not be pain. Like that, it is mentioned in our classical text. So, internal remedies are there and external therapies. Initially, if a pain is accompanied with some sort of swelling, we used to do certain treatments. If it is without swelling, we use oil, like that. So in inflammatory or swelling conditions, commonly we are using dry treatment. Means using some dry churnas or powders are made into a bolus, and in Malayalam it will be termed as kiri. Kiri is like sand, river sand will be used, and it is known as manal kiri or valuka sweda. Yeah, main action is the fermentation, swedana. Fermentation, due to that it causes the vasodilation, and it improves the circulation. That is the main aim of that our pain management. Several other treatments are there. If swelling is accompanying, then there we are using a dhara type of treatment, pouring of kashaya. Different kashayas are there, deshamula kashaya. According to the dosha predominance and according to the patient, it will differ.
So, in Siddha, are there any internal medicines you can give for?
Actually, Siddha also focuses both ways. That management of pain have two aspects also. Like Siddha is having 32 types of internal medicines and 32 types of external medicine. And in the management of pain also, there are some particular treatments. But as doctor mentioned, there are some traditional terms like Veda, Pattu, Ottadam, Pottanam. Pottanam is the kili, that is the Siddha term for that. Veda means fermentation, heat application. Pattu is poultice, externally applying like churna, dried churna or something like that. That will be triturated with some leaf juice or mere hot water, and that can be applied on that swelling. So, as doctor mentioned, if the pain is associated with swelling, then we will be going for Veda or Pattu or Ottadam like treatment. If it is it is primary dosha that is being deranged is Vata only, then the pain will be predominating other than the inflammation. Like rheumatoid arthritis cases and something like that, there will be degenerative changes also. In such cases, we will have to give internal medicines also, particularly
to reduce the pain.
Including that external management. Internal medicines also has to be given. other than external management. So such internal medicines primarily include kridas in Ayurveda and the nei in krida or nei in Siddha. Such formulations are all are to be given primary importance. It is like what to say, like loosening that tightened parts. Vada will be causing IS just for lubrication and for getting elasticity or retain the elasticity like that. Those type of formulations are also important. Beyond that, krida formulations along with kashaya formulations are also there. In Siddha, it is kudinir, Vada kudinir, Vada Sura kudinir is there. Nilavembu kudinir is particularly important for the management of Vada diseases. There are many pill formulations, guligai or matra in Siddha, like Vada Rakshasam guligai, like that is there. There are many other formulations like some modern adaptations of our traditional formulations are also there. Some Artiban 4 capsule is particularly important for such management of inflammation related to this arthritic conditions. And also there is Vadamarmakan capsule that is particularly important in degenerative cases, degenerative arthritic cases, rather than being just merely that pain management. And
so we have kashayas like Gandharvastadi Kashaya, Rasna Saptagam, Rasnerandadi. These also differ in certain conditions. In lumbar disc disorders, text neck or cervical spondylosis, it differs in certain conditions.
Particularly in conclusion, for the management of pain, we have to, the primary application will be, the primary importance will be given for heat also. If there is no inflammation, we will be giving primary importance for heat applications. That can be after oleation. After applying oil, we can apply heat. In such cases, Ottadam is important. And in some other cases, like doctor already mentioned, that hot vessel can be directly used on that area. Hot cloth can be applied on that area for relieving the pain. For getting lubrication.
So, Ilakiri, Patra Potali Svedam, yes. Medicinal leaves are fried in particular oil, which is comfort for the patient. Okay. We are not using same oil for every patient. We will choose it according to the condition of the patient. Likewise, medicated rice, Shashtiga Shali, or we have seen in Karkadaga Kanyi kit. That rice also it is boiled in certain medicinal kashaya decoctions, and then it is made into a bolus and applied over the body. That are several treatments.
Some oil formulations that are that has to be pondered in this case is some Vadagesari Thailam. That is a particularly important Thailam in Siddha. That is given primary importance in this Kevala Vada diseases or Vada diseases, that pain that is happening primarily because of Vada. In such cases, this is having primary importance. Also, Legu Vishamushti Thailam, that is also important. Another, there are a lot of oils, including Ayurveda formulations like Mahanarayana Thailam, Dhanundaram Thailam. There are a lot of oil formulations are there.
Very common now.
Common, yes. But those primarily, if in Kerala practice, Chinjadi Thailam, Kottanchukkari Thailam, that is widely being used used here in Kerala. That is primarily meant for the management of this type of Vada related pain disorders.
Aniga Vasti can also be done. A ring with the flour, wheat flour or masha flour. It is prepared, and in which side the pain is there, we are using that ring, and oil is poured for some time. Gradually, we will heat the oil and pour it in that. If pain is in the cervical region, it is termed as Griva Vasti. Likewise, Kadi Vasti. In lumbar region, it is termed as Kadi Vasti. Different lot of areas are there for pain management.
From this conversation, it is clear that we have many ways for pain relief.